I was the only person.
Sorry, I forgot that part.
It's okay. I graduated from my OT program in 2006, I believe, and we gave, these big presentations, and I happened to be the only one who talked about sex in that presentation. That was a long time ago, and everybody was like, and I don't know why I didn't build on it more back then, but in these last few years, I've become really a lot more passionate about it because I was working for Spectrum Health in their neuro rehab services department, and everybody in my department had been injured in a car accident. It was either car accidents or a few workman's comp people every now and then. And so you've got the whole age range, the whole, men, women, of all ages, and people were asking me about how they were going to be able to have sex again. We have spinal cord injuries and orthopedic injuries and head injuries. And people were asking me, and I'm like, okay, yes, of course. And I got really, really interested. But I've recently switched to my full-time practice, which is Wana Mama. I was doing it part-time for a couple of years. And I incorporate it as a service in my private practice. So I call it a sex and intimacy empowerment session because I just want people to feel empowered to ask for what they want and to give them the tools that they need. I can go on about that forever, but it is part of my private practice. I'm also an abdominal therapist. And I have training in pelvic floor therapy. And I do dabble in pelvic health with Wana Mama, of course, because I see so many women with pelvic pain and urinary incontinence and all that good stuff. So yeah, it's just kind of like the trifecta of health. So I think it all works really nicely together. So this talk is specifically about, just to kind of paint a broader picture about how sex and intimacy can be incorporated into healthcare and what that might look like. I know a lot of us might be in outpatient settings. I want to expand a little bit because I want to see everybody. Is everybody in an outpatient setting? Or, yeah, mostly? Okay. So a lot of this can be addressed in the clinic, of course, but a lot of it's just so broad and complex that some of it will definitely need to carry over into the home, and referrals might need to be made to somebody who can help on a more in-depth level. But getting the conversation started is the most important thing, is making people feel supported and welcome to talk about these things that can be really difficult for a lot of people. So just starting off, to give you a heads up, we are going to talk about, maybe this group is more comfortable than most groups that I speak to about sex. But some things that we talk about and some things that you see might be a little triggering for whatever reason. It might come up unexpectedly for you. So just please take care of yourself and feel free to take breaks if you need it, ask questions. Generally speaking, this should absolutely just be fun and collaborative, and we should be blushing and giggling and having a fun time. So I want to hear everybody's perspectives and experiences. So I certainly do not know everything, and I'm excited to hear what everybody else has to say about all this too. So like I said earlier, the goal is to generate dialogue, to learn from each other, because we need to reduce the stigma and the shame about sex and learn new strategies to help our clients, to kind of broaden our perspectives a little bit. Maybe we'll even personally take something away from this so we can try out at home. So it's all fun. A little pop quiz for you. We're going to start out, of course, we have to have a little pop quiz. People with disabilities don't want to have sex. True or false? Let me hear you.
False.
Because I can't see you.
False.
People over the age of 60 don't want to have sex.
False.
False. Absolutely false. People who have sex all do it basically the same way.
No. False.
And sex has to result in climax or orgasm for it to be good.
Gross.
Wow.
Just kidding. Oh, false. Sorry.
Toys, lube, and assistive devices are only for freaky people.
False.
Nope, we know that better than most people. People who use toys, lube, and assistive devices don't involve sex partners.
False.
Everyone deserves to feel pleasure during a sexual encounter.
True.
And everyone deserves to feel respected and supported when addressing sexual health with their healthcare provider.
True.
True. So this is a little blurb that I came up with. It says, every person, regardless of age, ability, background, gender identity, or sexual orientation, who chooses to do so, deserves to participate in sexual activity that is safe, accessible, and pleasurable. Amen. Okay, so sex is an ADL, and a very important one. An activity of daily living. It's the bread and butter of occupational therapy. Sex, as we know, is the pathway to reproduction. It can also, it can bring us joy and pleasure in our lives. It gives us a sense of self. It relieves stress, and it bonds us with others, with our partners. It can also be extremely complex and confusing and become a source of stress and emotional trauma for some people. Sexual expression and sexual activity are part of who we are as humans. And as healthcare professionals, we owe it to our clients to ask about their sexual health. This is just a little excerpt from the OT practice framework. We don't need to go into all that. And I'm just kind of driving it home because we do have a responsibility to ask and welcome the dialogue. I know that especially in a busy outpatient clinic, you don't have the time to go into a lot of depth, but and I know that a lot of you as pelvic floor therapists are, hearing a lot of really personal things about people anyway in their pelvic health. And I'm sure that sex and intimacy probably comes up quite a bit. But if you dig a little deeper, you might find, or you might have experienced this already, that you have, we as humans have personal biases. We have things that, the way that people might talk about sex, they might use different language. They might have totally different beliefs around sex that are totally different from ours. So it's important that we are aware of what our biases might be. And it's also important to not have strong assumptions about what a person likes or doesn't like, or what kind of sexual expression they show. Because when you ask somebody about their sexual health, you can't guess what they're going to say because you'll be really surprised. So be ready to hear anything, and go into every situation with an open heart and with curiosity. There's going to be cultural differences. There are going to be religious differences. You might get an 85-year-old woman who wants to do something that you would never dream of doing, and you gotta keep your body language, your how you respond to that will matter. If you close yourself off or change your tone in any way, that'll shut down the whole conversation, and could hurt the therapeutic relationship. What is sex? That's a loaded question. It depends on who you talk to. The trouble is that society has fed us so many confusing things about what sex is and what it should be and who can talk about it and who's sexy and what's socially acceptable. I think that these things are shifting and conversations are happening, and there's little by little, there's more acceptance of a variety of self-expression, but there's clearly more work to be done. So I put a little list here. I'm sorry, I am not telling you when I'm changing slides.
I got it. I'm keeping up. I'm like right up there with you.
Okay. So down below on this slide, what is sex? I just kind of listed a bunch of things, concepts, sexual, ways of having sex, erotic things. And I want you to kind of read through it and just kind of notice where your mind goes with these things. You might have personal experiences with some of these things. You may recoil with some of these things. You may feel disgusted. You may feel like, oh yeah, that's my jam. Who knows? It's just interesting to kind of see what comes up for you. So onto the definition of sex, the next slide. Spoiler alert, there is no script. There is no formula. There's no defining act, just you with or without a partner and all the things that make your body feel good. You can define sex however you want, and you can choose that definition anytime. This is an excerpt from a writer called A. Andrews. And this is from I think it's I was reading some, I was reading up on this person and they're absolutely awesome. So I have this listed in the resources at the back because I think this person is amazing. It breaks down so many barriers in just a few words, and it removes the expectations, the norms, the rigid societal constructs that we have managed to develop around sex. It just totally debunks everything, and I love it. So next slide, sex myths, misconceptions, and mishaps. That's a mouthful. But you're going to hear, and I'm sure we have all experienced this, that if you do ask about sex regularly with your clients, they might say, oh, no, I don't do that anymore. We don't do that. I'm too old. I can't have sex because of XYZ, this accident I have, this condition I'm dealing with. No one will want to have sex with me. My partner doesn't find me attractive anymore. I'm not good at sex. I can't have sex with my partner the way that I used to. It might feel different. It might not be as fun or as satisfying. Or maybe this person enjoys sex and their sexuality, but people have stigmatized or shamed them for it. So that's where tons of education needs to come in. This kind of dialogue can be nipped in the bud really quickly with some good old-fashioned education and some self-empowerment. And you can turn things around pretty quickly for people. It might take more for some than others, but some of this could be just a result of a lack of communication between a person and their spouse or their partner, or, a miscommunication or a lack thereof dialogue. Safety. So sex should be encouraged and supported in a mutually consensual, respectful relationship. So, we all know as healthcare providers to watch for those signs of people who are being possibly emotionally or physically abused, and this is certainly no exception. So as long as you know that everything is safe and consensual on the end of, for your client, facilitating sexual activity either independently or with their partner is what we should be doing. So educating clients, caregivers, and partners about how to set up or engage in sexual activity safely. And of course, following all medical precautions, which are endless, but you have weight-bearing status, you have movement precautions, you might have catheters, ostomies, ports, drains, incisions, skin, of course, skin integrity is a big one. And of course, preventing falls and teaching the person how to monitor, or their caregivers or partners who might be both, how to monitor vital signs. And of course, the use of prophylactics, if that's a concern. I already touched on this, the scope of practice. We're all in this. More from an OT perspective, OTs are looking at sex from a social standpoint. It's social participation. First and foremost, meaning that you have satisfaction in life, you build self-confidence, self-awareness, you build relationships and trust and communication. And, by having the skills around how to talk about sex and how to empower yourself and set your own boundaries will make you safer, and it reduces harm. I just truly feel that there's so much sexual harm that happens that could be prevented if people just knew how to advocate for themselves.
Janelle,
Yes.
Lily has a question in the chat. She says, what is the role of the therapist when it's apparent that the patient is struggling with an abusive relationship?
That is something that should be probably addressed, you know, are we talking about an adult or a child? They're, you know, adult protective services might need to get involved if you think somebody is being abused, or it is, or if there's a social worker involved to follow up. I would reach out to whoever you think is, if there's a social worker, or if you know that they're seeing a therapist, like a psychiatrist or something like that. But if it comes down to maybe filing a police report, I mean, sometimes, I mean, it could save somebody. So I know it gets really tricky and a little complicated, but if you don't, who will, you know?
Exactly. And they often divulge information to you that they wouldn't have talked about with like a gynecologist or their PCP.
Right.
Even sometimes their talk therapist, because sometimes it just doesn't even go there in talk therapy if they're going for anxiety or depression or CBT. So
yeah,
I think that's, for a lot of us, I feel like sometimes we're just like deer in headlights. Like, what do I do? What does this mean? Does it meet the criteria of a police report or protective services or something like that? And I know it's a case by case basis, but I often find myself wondering, and I didn't know if there was a protocol or procedure in place for that. Jen, I don't know if you've read anything up on this or.
You know, when we talk about it in class, we always say just check with your like institutional policy, like whether or not you have responsibility to report that or not. I just haven't had that situation. I mean, maybe I have, but I didn't like overtly know that I had it. You know what I mean?
Yeah. I mean, there are some situations where maybe we've actually witnessed a hostile or aggressive interaction between a client and their spouse or partner or something, or maybe a parent or a family member. And it really is a case by case basis. But I would say that if it raises concern for you, it's something to certainly follow up on. I think our instincts are pretty spot on. And if we're wrong, then we're wrong. But at least you know that you've done something.
Right.
Been productive.
Thank you.
Sure. So of course, you know, we're all really good at analyzing, you know, task analysis, activity analysis to get to the bottom of problems. And of course, fatigue, pain, med schedule. The context of the client is, you know, it's complex, you know, how they're experiencing pain, when they've experienced fatigue, what kinds of medications they're on, how they process sensory stimuli, and what their mobility and strength is. These are all things that I'm thinking about when I'm working with a client. Again, more education if there are partners and caregivers involved, the dialogue, you know, I don't know how much how much depth you're able to go into when you're in the clinic with a client to talk about the ins and outs, the intricacies of their sexual health. But if they're okay with it, it's a good idea to also involve caregivers and partners when that's appropriate. You know, they should be educated on the dialogue, how to communicate, and depending on the situation, how to be aware of different types of precautions, cleanup, setup, things like that. But also, if you have a person coming into the clinic who has a hired caregiver with them, not a family member, not a loved one necessarily, you know, there are ways to provide cares to people that don't feel sterile and clinical, you know, that cold medical feeling that people sometimes experience, because that might be the only person that they interact with. I don't know how often you see that in your clinic, but I see that a lot in different settings that I've worked in. And it's not necessarily a gratifying way to be touched. And it's not to say, there are of course boundaries around that. But if you know that a person cares and they're taking extra time and care to care for you, it makes a difference. I wanted to make sure I didn't have anything else to say about that. Oh, I actually wanted to give a personal example of that, because I've always been the therapist and giving the care to people. But I had a rare experience a few months ago where I had major surgery. I had a double mastectomy last November, and I found myself requiring care. And so suddenly my husband is now my caregiver. I couldn't reach up, I couldn't push or pull or repositioning myself was hard, pushing down, getting comfortable in bed. It was difficult. But also he had the wonderful responsibility of emptying my drains. And he was so tender and loving through the whole thing. And it made such an amazing difference. It wasn't rushed. He wasn't annoyed by having to do that every single day. It's kind of a gross job. And it made all the difference in the world to me, because I was, of course, now my body is totally different. I'm experiencing something that is hard and emotional, and I don't feel like myself. And he is taking extra care to make sure that I know that I'm loved and cared for, and that I'm still me. So that was huge. And I just wanted to share that, because, having the tables turned, having that other perspective, the other side, makes a big difference in how you care for others. Sensory processing is a big thing that we as OTs assess, and there are different ways to do that. Of course, just observation, but you can use assessments to get a sense of how people receive sensory stimuli and how they process it. There are a couple of the actual sex and intimacy assessments that are specific to that are rare. I only really know of one. If somebody else knows of any, please let me know. It's called the OPZ, and I thought I had it listed here. I wonder why I don't. So let me think. It's the occupational performance in sex and intimacy. It's shortened to the OPZ, and it's specifically designed for asking people how they like different aspects of sex. It's not all encompassing. It doesn't really talk about gender identity or sexual orientation or preferred pronouns. So keep those things in mind. I just wanted to throw out just a couple little examples of some assistive devices that people would use at home to help with their positioning and to help them have sex when their circumstances are different than usual. So here are a few examples. The wedges, pillows, props, bolsters are everybody's friend to create different, your ability to get comfortable in different positions and feel supported, excuse me. But also using household furniture, but thinking about, some people like to have sex in the shower. We need chairs, we need benches, we need grab bars, non-skid flooring, all the good stuff. And these are little examples of vibrators that help with, that people can use who have different abilities with their hands, like different grip strengths and dexterity, things like that. There are tons of them of different kinds, all sizes and shapes. So let your mind wander with this one. This one's a super fun one. can we think about any reasons that a person, like different types of injuries or surgeries or various conditions where someone might want to use these kinds of things? I'll give you a minute to process.
Spinal cord injury.
Mhm.
Even MS. I used to work in the neurological population, so any of my neuro patients I can think of.
Absolutely.
So yeah.
That's right. I was sitting here like dreaming up, I'm like, the list is getting really long about how to use these things. But these are clips that are just from sex toy stores. These things are not designed for people with disabilities. Isn't that amazing? It's just designed for fun. Okay, so an OT especially, but these things can come up in just conversation in the clinic too, but strategies on how to create a sexy environment at home. There are so many factors that come into play. I know personally that I hate having sex at the end of the day. I'm tired. I have not had the chance to decompress. And by the time I do have the chance to decompress, I'm tired and I want to go to sleep. So we have, I have been a lot more vocal in these last few years about trying it at different times, and kind of, you even almost have to schedule it sometimes so that you know what to expect. You can kind of get in that state of mind, and you can think about how you want it to go, like things you want to include in the whole experience, and kind of get it planned out. But so the time of day, energy levels, timing of medications, care schedule, things like that. Even little things that may not even be in the forefront of a person's mind, the temperature in the room, how, textures feel, how the bedding and the blankets feel. Is there background noise that's annoying, but you don't really know that it's there? What kind of lighting is going on? Maybe you want something on TV, maybe you want to look at pictures. Maybe you don't want the TV on at all and it's distracting. And also, of course, what kind of touch do you like? Do you like featherlight touch, or does that drive you crazy? Or do you prefer a heavier touch? What temperature is the hand that's touching you? Things like that. Do you like to be touched with different types of textures? Setup and cleanup is a big one. Setting things up, get everything within reach, think about everything you're going to want. And if you have urinary incontinence, if you have maybe a catheter, or if you have your urinary urgency, things like that, use the bathroom, empty the catheter, wash before and after. You might want to brush your teeth. You might want to zhuzh yourself up a little bit, put on something you feel good in. And then these are just kind of a list of different types of adaptive equipment and assistive devices that can come into play. Lube. Who loves lube? Yay! Lube should be happening every time. All of us should be using lube, even if it's spit. But I'm just going to go into kind of the different categories of lube. Please chime in if you want to add anything, please. Being mindful of what's in the lube. A high quality lube is always better. You're going to pay a little more. It's always better. Think about what kinds of things you want in your vagina. What kinds of things, you wouldn't eat certain things because it's bad for you. You don't put things in your vagina that are bad for you. So we don't want to mess with the pH of our vagina. Anyway, I'll go into that a little later, but water-based lube, pros, it's safe. It doesn't stain. You can use it with anything, with all toys, condoms, anything you want. Use it generously. The cons of it are that you shouldn't use it for anal play, but it's also our body absorbs water so quickly that you end up needing more and more and more and more. And then it actually can potentially create more dryness. So it's kind of a bummer sometimes, but not for everybody. Hybrids are interesting. They're a combination of water and silicone. They are safe, they last longer, they're good to use with toys, but you should always wash everything after you're done using it. The bummer of silicone, because personally I think silicone, oh, I have all the lubes that I want to show you. Silicone lubes are, I think, the best as far as sensation goes, and they last longer. They're wonderful. They feel really luxurious. They keep our tissues safe. They reduce friction and the risk of tearing and shearing. And it reduces pain if you're dealing with painful sex, if you have pain with penetration or even vulvar pain. Yeah. So I have a few of my faves. I have a billion samples of Uber Lube. Who loves Uber Lube? I'm gonna turn on my, yes. Okay. But there are some things that you want to avoid. I feel like this is an old, I updated some stuff in here and it's not there, but has anybody heard of propylene glycol? Yeah, you don't want that in your lube. So make sure it's not in there. It's not in here. It's not in these. This is Joe. These are good ones. Wicked is also a good brand. I have seen a version of Wicked that does have propylene glycol in it, so be careful about that. This one does not. And then I love Nice and Naughty. Has anybody been there before? Yes, they're wonderful. If you pop in there and you have a question about anything, they're so knowledgeable and helpful. But they've kind of repackaged and branded their own lubes that are really nice. I digressed. Okay, so just if you're using a silicone lube with toys, wash everything. It can break down silicone. And it can also, I mean, there's some Jen, do you have an opinion? I've read different things about the safety of using condoms with silicone lubes.
I don't know.
Okay.
I defer to the group.
Usually the bottle will say it's safe with latex or different types of condom materials. So just read the label and just be thoughtful about that. And oils. So we have water-based, we have hybrid, we have silicone, and then there's oil-based lubes, which are wonderful for massage and skin-to-skin contact, but they're not good for penetration. So I wouldn't suggest using an oil-based lube for vaginal or anal penetration, especially vaginal, but because our tissues just can't flush out the oil very quickly. And if you are prone to yeast infections, it's certainly not the best choice. Yeah, I think that's all I wanted to say about that. Okay. Oopsies. I'm stuck. Oh, there we go. Okay. More interventions and approaches, of course, just considering cognition. Can the client, are they behaving appropriately? Are they socially appropriate and able to have a mature and appropriate conversation around sex? If not, you might want to avoid it. But of course, all the things that come into play when having sex is communication skills, problem solving, planning, sequencing. How can we downgrade or upgrade the task or activity? And of course, communicate with their team. When I was working in neuro rehab, I did a lot of education with the caregivers. If there was, usually it was more for just to set up a person to masturbate. And that's typically the situation in the environments that I was working in. And it was just, I found it really important to remind the staff that that this person also deserves to feel pleasure in their body, and there should be zero shaming around that. So the language that they use was really important, and making sure that they have everything that they need and they had adequate time and privacy was really important. Anyway, tips for engaging in intimacy, which is really just getting that connection with a person that you care about. But also, I mean, intimacy is pretty broad. I feel like we're having an intimate conversation right now. Feeling safe and supported in anything that we're doing. Like, we all feel safe, hopefully, sitting here and having these conversations. But there are, you know, being intimate with your partner when you're not up for all the other stuff. If you're not up for having sex, if you're not up for certain things, but you still want to be close and connected, there are certainly ways to do that. And communicating what you need and what you want in that moment is going to be really important. So there are lots of ways to do that. And I list out a bunch here. Also, yeah, just emphasize the importance of checking in. How does this feel? What would you like to do? How can we make it better? Those are all important things. And oh yeah, this is an old version. That's okay. So if we could just hold for a moment. I'm gonna see if I can pull this up here. My apologies. Well, okay, so I actually outlined, I like this, the 3 A's, but I have basically 4 musts for good sex. And it's good for me to try to remember them off the top of my head anyway. So the first one is boundaries, setting boundaries and giving consent every single time. That goes for, if you just met this person today and you know you're going to have a one-time thing with them, obviously consent needs to happen. If you've been married to this person for 30 years, consent needs to happen every single time. It doesn't matter. So learning that what dialogue is required to communicate what you're okay with and what isn't, and setting those boundaries is first and foremost. Let's see, number 2. Okay, being open to new ideas and to feedback from your partner. So giving and receiving the information about what brings you pleasure in your body, hearing what brings your partner pleasure, and also having this conversation when you're not having sex is going to be really helpful. It's a lot of people end up like in the throes of things and you're like, whoa, I don't really like where this is going. That feels terrible. And then there are hurt feelings, there's frustration, and it can kind of shut things down. So it's important to have the dialogue outside of the moment of when sex is happening. So sorry, I'm flying off the cuff here, but so saying things, you can also, of course, reinforce things in the moment. Like, I love it when you do this. That was awesome. The conversation should be happening before, during, and after. Like, that was awesome. Next time, let's try this, or let's do this next. I mean, the words are important. If you don't have words for whatever reason, just consider how communication should happen. Are you guiding hands? Are you, I don't know, are you, touch is probably the next best thing to communicate what you want. The benefits of healthy and safe sexual activity is amazing for decreasing stress and anxiety and depression, improving self-esteem and self-confidence. It does decrease the experience of pain, and it improves blood flow and circulation to all areas of the body, which of course promotes healing, which is wonderful. It improves our physical strength and mobility, and it improves our energy, and it builds trusting, healthy relationships. So if you are one of those people who is a little bit hesitant to start that conversation with your clients, but you know it needs to happen, I listed out a few ways you could do that to get the conversation going. And it may be that you're not the person to see that, to see everything through. It's okay if you're not that person. All you have to do is ask, get the answer if the person wants to address their sexual health, and then kind of where to send them and what to do. All you have to do is to be an open listening ear and a supportive person to help them to the next step of things. So I encourage you to kind of read through these. See what resonates with you. If you are one of those people that's like, oh, I just don't really know what to say or how to get it started. And there are more on the next slide too. But an important part though, is that if they say, no, I'm not interested in talking about sex, clearly we do not push that. If they say no, that's the end of it. And just let them know that you're here for them if they change their mind. So I put a few little thumbnails of some regular everyday things, and I want us to talk about how these can be used for sex and intimacy. I want to hear from you about it, if you're okay with it. I want to hear ideas.
I think one of those, hi, this is Erica, sorry. I think one of those looks like a hairbrush in the bottom left.
Yeah.
I mean, doesn't any girl at least love it when people play with their hair? You get like the little tingles. It just feels so good. And then, that could easily be
Absolutely.
nice and saucy time.
That's so funny. I hate people touching my hair. Don't touch my hair. It'll give you like a huge.
There you go.
Or a nice
Right?
head massage, something.
Now the blindfold, that looks fun.
Mm-hmm. Yeah. I mean, covering your eyes and taking out that source of stimuli so that you can really feel what is happening in your body and to your body is a totally different experience. Some people would absolutely hate it, and some people would absolutely love it. So it's something to think about. Yeah, there are lots of erogenous zones all over our bodies. So going back to, just the idea that you don't have to have penetrative sex to have good sex. You don't have to, sex doesn't have to, or even oral sex or anal sex. It's like there are other erogenous zones of our body to explore where you can experience different kinds of pleasure, really deep and fulfilling pleasure. Ears, head, neck for some of us, not Jen. Nipples, low back, hands, feet. I mean, it's the list goes on, and it's just it's like a playland to explore, to keep things interesting, to keep everybody excited, I think.
I don't know what the American movie was. I think it's called The Bright Side, where the gentleman is paralyzed, I think neck down. And so he uses his earlobes.
Yeah.
I don't remember what it's called. I just know we watched it in PT school.
That sounds familiar. That
Yeah.
There's also the Untouchables is the original French one.
Thank you. That's what we watched, The Untouchables. I
think the Bright Side was like, there was another one, but I think the American version of the Untouchables was still called Untouchables, I think.
thank you for helping me out.
It was a really good movie though.
I'll have to check that one out. I really liked the show Sex Education. It's on Netflix. It was awesome. That was awesome. You should watch it. Any other thoughts about these?
Ice cubes. Just don't swallow it by accident.
Yeah, at least they'll melt pretty quickly, but yeah, you're right. They're more for like mostly the outside, but you know.
I had a patient one time tell me, I don't know, I'm thinking about oral sex with an ice cube, but I had a patient one time tell me she had her boyfriend popped over for like a quickie or something unannounced, like just showed up, and she had, I don't know, like some mouth sore or something that she put some peppermint essential oil on and then engaged him in oral sex.
Wow.
I didn't think about like burning the crap out of his body from peppermint essential oils on his mucous membrane.
That feels great.
What you have in your mouth for oral sex. Wait, what was the Netflix show? I wanted to write that down.
It's called Sex Education.
Was that the Gwyneth? That wasn't the Gwyneth Paltrow one.
No, that's Goop, and that was awesome too. That was really great. But Sex Education was about basically about a bunch of high schoolers who go to a high school that starts out as being very sex positive, but everybody has these questions. You know, there's people who are lost, and it comes down to this kid kind of he ends up giving like sex advice in this back shed of the property of the school because his mom is a sex therapist. So he's
That's
really
awesome.
Yeah, but everybody is really, it's like over the top sexualized, which I think it's just really fun and entertaining, but it's in a healthy way. And they've also give lots of examples of unhealthy ways to express to how to treat people with respect when it comes to sex, what's okay and what isn't, the traumas that are left behind when people are treated with disrespect. Yeah, it was amazing.
There's another show that I'm hoping to watch on Netflix. I just saw it pop up. It's called The Principles of Pleasure. And I don't know if any of you guys have seen it, but it's sex, joy, and modern science converge in this eye-opening series that celebrates the complex world of women's pleasure and puts stubborn myths to rest. So I took a screenshot of it because I saw it pop up on Netflix real quick. So I don't know if it's any good, but it's on my list of things to watch.
Yeah, I came across that last night. It's definitely on my list as well.
Yeah, so it'll be interesting.
Yeah, there are lots of things coming up that are really great, like awesome, informative, sex positive shows and books and podcasts and all kinds of fun things that are coming out. I love it. So these are some resources for adaptive equipment and assistive devices. Sport Sheets is awesome. I believe that's where I got the images of the assistive devices with the straps and stuff up above. Blush is a really great company. They have great customer service and really nice products. Intimate Rose, we're all familiar with that company, I think too. But I contacted Lube and asked for samples, and they sent me a truckload of samples. Some of them were in little glass vials that were super awesome. Anyway, lots of things to tap into here. Here's some websites and books, couple of books. I also should have listed the V Hive. Has anybody heard of that? The V Hive? It's a podcast. Hannah, she is in the pelvic health world. Just, I think the first time I saw her, she was doing some kind of online forum with pelvic health specialists. Like, I don't know. I'm rambling. Sorry. Anyway, the V-Hive is good. Oh, there's the OPZ I was looking for under assessments. Yep, credits. And I think that that's it. Since this is an old version, I can't remember what else I put in there. So are there any questions or things that should have been touched on that were not, or anything you want to elaborate on?
Do you have, so I have the Herman and Wallace like positioning guide for orthopedic positioning guide.
Yeah.
But I'm wondering if there's anything that is more like less gender specific that you know of, or like, you know.
Yeah. There's it's called Sex Intimacy OT. She has, if you create an account with her, she has a few little online CEU courses, but and tons of resources. And there are illustrations of, she's really careful about not being gender specific, to being kind of gender neutral. And I remember seeing a really nice handout for like hip precautions and other kinds of positioning for different orthopedic injuries that were illustrated in a really nice way. Yeah, Sex Intimacy OT. Hi, Lily. I didn't see that you were here. Good to see your face, kind of. Yeah, so I think that that's about it.
I would like to hear, like, tell us about like a client that would come to you, like when you do your sex and intimacy empowerment session. Like, if we were to refer somebody to you, tell us what to expect, like what that visit would look like, or what that assessment would look like.
So many ways it could go.
Tell us about like a client that might be like a pelvic health client that we can relate to.
Okay, let's see. So I have one now. I have to choose. Okay. I have one now that has had some sexual trauma, and she has pain. And what I'm doing with her is sort of a combination of abdominal massage to help her. It's sort of a process of helping her just learn to relax and breathe and bring awareness to her body. It also, the manual work helps align the organs and tissues, and it promotes flow, blood flow, nerve innervation, movement of lymph. And so with what I'm hoping for is with the physical changes that she'll hopefully experience with the abdominal work, that she'll experience some emotional changes as well, and some changes in pain. But I gave her before we even went into the manual work, she was expressing some of the issues that she has from her past trauma with her current relationship, where she's now in a really loving, supportive relationship, which is wonderful, but she has a lot of anxiety and these reflexes that she doesn't have a lot of control over, where like if he reaches for her, she immediately does this. And she wants to be touched by him, and he is always okay with her reaching out to touch him. So we're working on strategies and how to communicate, asking for permission teaching her how to ask for permission to touch him, and for her to teach him, I haven't met him yet, to ask and give her a heads up. It's a whole new thought process you have to go through when you're with somebody new and you're getting to know them and how they need things to be done. So doing something that will let her know that he's about to touch her. So that she's aware that they can, they'll have to have that conversation themselves unless they both come in and we can talk about those things. But we've only had one session actually, and it was just last week. So we talked about strategies for that. And then we did the manual abdominal work, and it was beautiful. So sometimes it's a combination of things. I had a client, I still have her, I've been seeing her for a long time, who has really severe cerebral palsy, and she uses a wheelchair. And we had to start out with guilt because she is single, she's not partnered. She has had sexual desire. She wants to feel sexual desire again, and she wants to feel good in her body again. And she feels guilty about that for religious reasons. And so we've had to work through those things. And then the physical aspects of it are that she has very limited mobility in both of her hands, but one more than another. So we had to talk about, she wasn't even sure if she could be aroused anymore. She hadn't been aroused in over a decade, and she wasn't even sure if she was capable of it anymore. So we explored ways. I gave her some resources and some ways to explore that on her own, and she reports back to me about how it went. And then we started talking about assistive devices. This is over, like, it was at least a few months of getting through all this, and talking once a week. Then we started talking about assistive devices that would work for her. She has a suprapubic catheter. She has lots of spasticity. She has limited use of her hands. So we were exploring different devices. We finally actually went to Nice and Naughty and bought something, and we're still we're still exploring. But she did realize that she can become aroused, and that was extremely exciting for her. And she just felt really, just really happy that she's capable. Like, she knows that she can. And so that's been really a fun process to go through with somebody. And now she's just really pissed that she's gone her whole life. She's 50, and nobody has talked to her about her sexual health until now. No therapist. I mean, she's been in PT, OT, social work, endless counselors, the whole thing for her whole life. And nobody has addressed sexual health with her.
It doesn't surprise me at all.
Can I ask a question?
Yes, please.
And I hope this isn't too far off topic, but for that patient in particular, like, are you billing insurance for her, or is she private pay? And the reason I ask is because I want to start educating those women who are interested in learning more about sexual health. Oh, the screen changed. Okay. Like, I want to be able to have more of those conversations. And so far what I've been doing is kind of just like educating them on resources and saying, this kind of information is out there. Here you go, but I don't make it like a goal to check back in with them on like arousal stuff. Like, I feel comfortable seeing them for sessions, okay, we're going to get you back to pain-free intercourse and tolerating vaginal exams, but like, I feel like as a PT that works with insurances, are we able to write goals for arousal? Like, is my question making sense? I feel like, because I've had a few clients, we get them back to pain-free intercourse, but then there's the whole issue with orgasm and arousal. And I don't know how far to take that as a PT, is it enough? Well, it's not enough just to give them resources, but is it my role to keep seeing them and trying to work with arousal issues, or does that more referring to maybe like a sex therapist?
Maybe. I mean, what codes would you bill under sexual arousal? I mean, I would, it's like therapeutic I would use therapeutic activity.
I use ADL self-care.
Yeah.
I've stopped making pain-free goals. I make, well, not like vaginal exam with pleasure, but like I'll make a goal like intimacy with pleasure.
Yeah.
Versus
chances are, if you're aroused and in a space where you feel like you could orgasm, your pain, the original pain that you were feeling is probably not there for at least that moment.
I think there's a lot of like neuromuscular downregulation and circulation that you can use those terms instead of like arousal.
Yeah. Okay. I figured there was like a workaround, or how to say it professionally.
But I also I have always felt up until maybe this year, like, okay, I understand how to support people in decreasing pain, but I didn't know how to support people in increasing pleasure.
Yeah.
So, this is why I'm going to the course next weekend, because there's a lot of people that won't go to a sex therapist, that won't take that next step. And how can we equip ourselves as PTs and OTs? And I think it is in our wheelhouse. Absolutely. Mm-hmm. Because it is a physiologic process.
And when it comes to desire and pleasure, those client factors, their context comes into play so deeply. What is happening in their life that is preventing them from being able to get into that space of pleasure and arousal? It could be that you have new mothers who have recently given birth, or people who are raising young families, or people who are working 50 hours a week, or there are so many, or people who are in a stressful relationship. It's just, there are so many factors that come into play. So that's why it's so complex. And I know, I kind of have realized where my scope ends, and a psychiatrist or like a family therapist who is trained in sexual trauma and things like that, where that begins, my role ends, and I refer out. And I'm still in the process. I have a few that I refer kind of locally. But I really want to meet more people, because a few is not enough, because it's not going to be right for everybody. I need to kind of try to do my best to give people referrals to people that I think that they'll connect with well. But also, as far as billing and codes and stuff, I am a private practice. I'm out of pocket. I don't deal with insurances, which is amazing for me right now. Yeah. So I document what happened during the session, the goals, the progress, what we reviewed, and take cash. And that's the end of it, which is why I'm in private practice.
Your side gig, Sarah.
Yeah. What was that?
I said for Sarah, that can be her side gig.
Maybe someday. I did actually, Jen, I did get a new job actually.
What?
Yes, I am done at Mary Free Bed middle April, and I'm going to Hulse Jepson to do pelvic floor full-time. Yeah. Finally, full-time pelvic floor.
Yay! I'm so happy for you.
Yeah, I feel like I'm finally going to have like a pelvic floor team and mentorship that I've always wanted.
Hulse Jepson is great too. Is anybody here from Hulse? Yeah, I love, now I can't think of her name. Starts with a K. Anyway, they have a lot of good people. You'll be, which office are you going to work at?
It's in Wyoming. and it's right near 44th and Burlingame, and it's just a pelvic floor clinic. It's just Stephanie Smith and I, if you know her.
Oh, I love her so much. I used to work with her. I love her so much. Oh, I love her. She's awesome.
Yeah. So it's just her and I in this cute little clinic. Just for
Oh
pelvic.
my gosh, that makes me so happy.
Yeah, good.
Awesome.
I'm gonna quit Spectrum. Come work with you guys.
Yes.
I live like
Not
3
even
minutes
tease,
from there.
Jen.
What'd you say,
I said,
Lily?
do not even tease, Jen.
I
Okay.
know, right? I'm teasing. I've been there 25 years and I'm gonna stay.
I know. I've heard it before.
Janelle, that was awesome. Thank you so much.
Welcome. Thanks for coming, everyone. I appreciate it.
Yeah, I'm gonna stop the recording and then we can hang out if you guys want to.
Cool.